Today in Tucson and Phoenix, I met with chief medical officers and other leaders from Arizona's hospitals.
In March, Governor Doug Ducey ordered hospitals to be ready to increase their capacity by 25% in case there was a surge in COVID-19 cases. Last week, Banner Health Systems announced it is nearing capacity for its ICU beds statewide.
Over the last period of approximately 10 to 14 days, we have seen an increase in the number of confirmed cases across the state, as you've mentioned, but also here locally in Pima County in the Tucson area. That is translating into increased demand for healthcare services at our facilities.
The spike in cases is not concerning Governor Ducey. During his weekly briefing, he said the surge was expected.
We know to the bed where we are in the state of Arizona. ICU beds in mid-March, 1,532. Today, 1,657, plus 600 additional surge beds that would be available as needed. And today, they are not needed.
Last month, when the CDC released its guidelines for lifting stay-at-home orders, it said one of the criteria to go to Phase 1, where Arizona currently is to have no more than 80% of hospital and ICU beds filled for more than 5 days. Arizona, for the last 2 weeks, has been hovering on both sides of that mark.
Arizona hospitals are increasingly constrained in terms of resources in the increase in COVID positive patients, both in the ICU and inpatients. This is the 6th day in a row that we've seen numbers for inpatients at 1,200 COVID positive patients statewide, whereas for a good part of May, it was maybe in the 600 patient range.
The CDC also defines a rebound in cases as when the 3-day average of cases shows an increase for 5 days. Arizona's cases are rising, which means more hospitalizations.
Hospitals are not a limitless resource. It is limited. And we need to make sure that we contain the spread of COVID-19 in our communities.
When Banner announced it is reaching capacity for COVID patients, one of the issues is ventilators. In particular, Banner is running out of what are known as ECMO units.
It uses a cannula that is inserted into a large vein of the patient. It removes the blood that is deoxygenated, and it uses pumps to remove that deoxygenated blood and then to pass the blood through a membrane oxygenator that basically uses an artificial lung that's outside of the body to put more oxygen into the blood. And then it, again, uses a pump to pump that reoxygenated blood back into the body.
When hospitals reach their capacity for COVID patients, they are supposed to call a state hotline to help find available beds. That's happening in Tucson.
We do load leveling in the Tucson market between our two facilities, the South Campus and the Tucson campus. We're able to share and pool resources to maximize our ability to care for our community.
The CDC guidelines also say that hospitals should have enough coronavirus tests for their own staff. That, too, is becoming a problem in Arizona.
Hospitals need adequate testing supplies. I've heard shortages of swabs, reagents, medium that you store the sample in, and then delay in laboratory testing so that hospitals are waiting, 2, 3, 4 days to get a laboratory result in order to discharge a patient safely. And if you're unable to discharge patients, you begin to take up that very crucial capacity in the system.
The coronavirus pandemic does not show any signs of letting up in Arizona soon. Hospital officials are worried not only about capacity, but also about staff burnout, something there's no federal guidance for.